Hello viewers, welcome back to ANDROCARE channel. Last video I told you about our piezo wave 2 shockwave therapy machine, about that one, and how shockwaves are given, how many shockwaves we give for erectile dysfunction, how many we give for Peyronie's disease, and how many we give for prostatitis. So this is our machine. Now we actually one more machine came to our center for demo. Right now this is the machine, this is the new machine, and I think if you are our Telugu channel subscriber, I think around 2 months back we had one machine called Dornier. So I had demo of that, we tried that in many patients. So now one more machine has come for demo. This is not our machine, this is our machine, but this is a demo machine. We are still evaluating how it works on different patients. Generally why we do demos is these machines are very expensive. So unless they are working on the patient, generally whenever a new therapy machine comes into India, they approach us, they approach ANDROCARE for evaluation. So what we do is we take the machine, we keep the machine for a couple of days, we try on multiple patients. Anyway, this is not like a clinical trial. Basically there are no harm with these machines, there are no side effects with these machines. All these machines are approved, properly tested, but from country to country, manufacturing wise, quality wise, you will have different scenarios. So this is a German company. I think this is manufactured in Turkey. So this is called Modus EDSWT, and this one, the only difference between piezo wave 2 and piezo this is lightweight. That is heavy machine and this is lightweight, but that is a linear applicator and this is a focused applicator. So that means if you see the probe here, all these waves will be concentrated at one point. They will focus at one point and the action will come only in that on that particular point. So now the disadvantage with focused therapy is you have to decide on how many places you have to give this therapy. So but whereas if you see this one, this is for the piezo wave 2, here this is a linear therapy. So now your therapy source is linear, so all the waves will come perpendicularly. So you don't have to identify the place on the penis. If you keep it on the penis, like this, you send shock waves to all parts of the penis. But here, if you see here, now you have to give shock waves at this place, then again here, then again here. But always what happens is that remaining area, you can't get enough shock waves. So that is why here you have to carefully plan how many shock waves you are giving. So next time you should not see if one therapy is given here, if you are giving some shocks here, second if you are giving some shocks here, then this part next time you have to target. Otherwise you have to keep on rubbing like this. But here what happens is, here the number of shock waves is different with piezo wave 2 therapy. But and this is the, if you see the machine, here you can actually select, say there you have to change this for different kinds of therapy. The applicator is same. Here applicator is same, but here you have to select for what therapy you are using this therapy. See, if it is erectile dysfunction, you have to choose erectile dysfunction. If it is urology, see, if you see here erectile dysfunction, prostatitis, Peyronie's disease, vaginismus. So if you choose erectile dysfunction, see, then you get here. Then already this is erectile dysfunction software is already loaded. So once you start, here you don't have to decide, it's already prefixed. This is how we have to give it on the penis. I am just showing, actually you have to give at least 300 shock waves at one point. Whereas piezo wave therapy, you can directly put the therapy source on the penis and you can use shock wave therapy. But see, each and every company is different. They have their own clinical trials, but generally what happens, we have to choose which machine is working for Indian patient scenario. Whichever therapy source is working for us, then we generally buy that and give it for our patients. So that manufacturing technology is different, that is electromagnetic, that is piezo wave 2 technology, and this is electromagnetic. So depending on the source, depending on the outcome, depending on the patient's feedback, we start buying those machines. So viewers, I think I explained about piezo wave shockwave therapy and Modus shockwave therapy. Regarding these results, now clinical trials are going on in our center. Once we complete at least 10-15 patients, generally then we'll ask the patients how the response is, and if already there are some patients who have taken shockwave therapy with piezo wave 2, generally we'll call them back and we ask them their feedback, which machine is working well, which has better improvement. Based on that, then we decide whether to buy the other machine or not. So if you have any doubts, viewers, keep asking in the comment section. Based on that, if I think one more video is necessary, then I will try to make some video. One final suggestion or advice for all those people who are looking for shockwave therapy is, see, there are around 6 to 7 companies, all are international companies in the market which are producing shockwave therapy. We have all these companies are basically from reputed companies where they had enough clinical trials before releasing it to market. So now whichever hospital you are going, wherever you are taking shockwave therapy, first see which machine they are using, and you can go to their websites and see their protocol. So why I am saying is, sometimes some people they just buy Chinese machines. There won't be any name or any company name on the shockwave therapy. Just you will have some name called shockwave therapy machine or shockwave therapy. Basically they are all Chinese made. So you find out, you just see, if you see the machine you will know which company is that. Whether it is any standard company will have a name written on that, and you can actually go to their websites, and once you go to their websites you can see what is the actual protocol, how many shock waves to be given for erectile dysfunction, prostatitis. The protocol is different for machine to machine. So you just go through and then go ahead with the therapy. This is my sincere advice. Thank you.